This is John Goff, and today I am at the City of Philadelphia's Department of Behavioral Health. Recently, the department held two events at the College of Physicians, a Trauma Champions Day in December, and this January, a symposium on problem gambling. And today, to reflect and recollect on both of those programs, I'm here with Arthur C. Evans, PhD, Director of the City of Philadelphia's Department of Behavioral Health and Mental Retardation Services. Thank you so much for your time, Dr. Evans.
Thank you. I'm glad to be here.
Good, good. Well, I have a couple of quick questions, and I wanted to start with gambling because that was our most recent forum. It was a fascinating forum, and we have some video from that forum we want to get on our website as well. And I think one thing that I felt watching the program and the keynote speaker and then talk to others about is that I've been down to Atlantic City, and I've won $300 playing blackjack.
Lots of people have.
And
right.
that is such a rush. It is such a high. And what is the difference in your mind between enjoying that high and having a problem gambling?
Sure. Well, you're right. A lot of people have experienced that high, but the difference between someone who can enjoy gambling on a recreational basis and someone who has a problem with gambling is the compulsivity and their inability to limit their gambling. And so while you were able to walk away and enjoy your winnings, someone who has a problem with gambling would not be able to do that.
I feel like there are a lot of families out there suffering with a family member who's dealing with problem gambling. How would you suggest someone approach a family member that they feel is gambling too much?
Well, I think first of all to recognize that gambling can be very destructive to families. Families lose a lot of money, people get into criminal activity, and I think it's important for family members to be honest about what's going on with their family member and to direct them into help, or her into help, but to not simply accept the fact that this person has this problem and may not be willing to go into help, to get help for themselves.
And speaking of help, what kind of resources does the Department of Behavioral Health offer for those suffering with?
Sure. Well, there are a number of resources in the city. First of all, the state has a statewide program. They have about $1.5 million spread across the Commonwealth. They've trained a number of individuals to be able to provide gambling services. Some of those individuals are in Philadelphia, and when someone has a problem gambling, with gambling, they can go to those individuals and the state will reimburse the provider for those services. For individuals who have Medicaid or medical assistance in the city, my department will pay for their care if they have a pathological gambling problem. One thing I want to point out is that there's a difference between problem gambling and pathological gambling. Pathological gambling being a more severe form, and that is a diagnosable mental health problem, and therefore it is reimbursable under a medical assistance program. And for some individuals who have private insurance, it would be eligible for reimbursement under their private insurance. For individuals who have problem gambling, which doesn't quite meet that clinical criteria, unfortunately there are not a variety of resources or the kind of resources that we would like to see in the city, and that's one of the things that my department is working on, is looking at how do we bring in funding streams that will allow us to provide care for and support for individuals who have that. They have problems, but it hasn't reached the point that it's a diagnosable mental health problem.
And I think that's something else I wanted to talk about is what do you feel like is on the horizon in terms of research and treatment for maybe both pathological and problem gambling?
Yeah. Well, I think what we'll see increasingly in this area is what we've seen in other areas of mental health. One of the things that it's been shown in the literature over and over again is that different things work for different people under different circumstances. I think that is as true for gambling as it is for any other condition. And so I think the real frontier is really understanding, one, what are the most effective treatments, and for whom do they work, and under what circumstances. One of the questions that, for example, that I think we have to answer is there a difference between individuals who perhaps you are gamble in casinos versus people who do scratch-offs and are sort of addicted to that, and are there different treatment approaches that one wants to use. We also want to know about potentially medications that might help people in terms of their gambling problems. So I think that there are a lot of questions that are out there. There are some treatments that we know work more effectively than others. For example, cognitive behavioral therapy as an example, that cognitive behavioral approaches tend to work a little better than some other approaches. But I think we still have a lot of unanswered questions about how do these different treatment strategies work differently for different populations.
Absolutely. And one final question about gambling that I feel I have to ask is that, you know, it used to be that you had to go to Atlantic City to do some gambling, and now you can go to Bucks County or Chester, and there are going to be 2 casinos in Philadelphia at some point in the future. And how do you feel like that's going to affect the landscape of gambling and problem gambling in the city?
You know, actually, I don't think it's going to have that much of an impact, and the reason is gambling is pretty available if you live in Philadelphia. It's easy to go to Atlantic City. It's easy to go down to Delaware. We have lotteries. There are lots of ways. If someone is interested in gambling, they can gamble. And so while there may be an incremental increase in these areas, my view is that the issue of problem gambling is here. We've done focus groups with individuals from Philadelphia. We know that there are lots of families, hundreds, thousands of families in Philadelphia that are affected by problem and pathological gambling today. So our goal really is to try to address those issues, to create a network of services, to work with the private sector, to spur them on to make these services available, and to make sure that anyone who does have a problem can get into treatment if they need it, and most importantly, that we can prevent people from developing these kinds of problems in the first place.